Thank you for joining today's conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo.
Hi, good morning. It's Andrew. I'm joined by Melissa DeRosa, Robert Mahica, Gareth Rhodes, Dr. Zucker. And I want to give you a quick update because I just got off a meeting with the White House and the governors. Today is day 346. The positivity rate is 5.12. It's from the numbers, the post-holiday reduction continues. If you want to be specific, you can say the post-holiday surge reduction continues. The 7-day average is 4.3 today, and that's the lowest 7-day average positivity since December 1. December 1, really the Thanksgiving infection rate hadn't really kicked in. So we're back to where we started on the holiday surge. 138 New Yorkers passed away from COVID yesterday. They are in our thoughts and prayers. The number of hospitalized was up 159 from the prior day. Discharges were lower because the discharges over the weekend are lower. The number of patients in ICU were down 42. The number intubated were up 10. The 7-day average is what we watch because day to day there's a lot of fluctuation. These are not random sample tests on a daily basis. So positivity by region, Long Island, 5.36. Mid-Hudson, 5.34. New York City, 5.1. North Country, 4.7. Western New York, 4.1. Capital Region, 3.4. Mohawk Valley, 3.1. Finger Lakes, 2.9. Central New York, 1.8. Southern Tier, 1.8. Statewide, 4.3. In New York City, the Bronx, 6.8. Brooklyn, 5.3. 7. Queens, 5.34. Staten Island, 4.9. Manhattan, 3.2. Someone needs to do a study of the demographics of how this infection rate has traveled. Staten Island is down, and I thank the people of Staten Island who changed their behavior and changed the infection rate. But Bronx first, then Brooklyn, then Queens, and Staten Island, then Manhattan. On the vaccinations, we've done 2.5 million total doses to date. That means about 10% of all New Yorkers have received one dose. We're at about 92% of allocated first doses. So we're going week to week, as we've discussed on the allocation. And the whole question is the supply. You now have about 10 million New Yorkers waiting on 300,000 doses. Big question on the call with the White House coordinator by the governors is supply. When will the supply increase? The supply will really only increase when and if Johnson & Johnson is approved. The Pfizer-Moderna vaccine are ramping up, but the ramp up is relatively slow, so we won't see a major supply increase from Pfizer and Moderna, nowhere near what we would need to make rapid progress against the 10 million. Johnson & Johnson would be a major and significant increase in production. But that's over the next 2 weeks. We'll get more information on that. The White House did announce a 5% increase in vaccine allocation and again announced a 3-week projection. for that allocation. So the allocation will go up about 5% to the state, and that will be true for 3 weeks. The 3 weeks is a big deal from a planning point of view because the states didn't know what they were getting next week, literally until a couple of days before. We would then turn around and tell the counties, and then the counties would say, well, I had no notice. I know, because I had no notice. But the 3-week projection actually helps that. The 5% increase doesn't sound like much, but remember, that's on top of the first announcement, which was 16% increase, then the second announcement of 5%. So this is a third announcement of 5%, 16 plus 5 plus 5. So over the past 3 weeks, it has been relatively significant. Again, not proportionate to the need, but that has been helpful. The federal government also announced that they would directly allocate to some what they call federally qualified community health centers in the state. And that allocation would be above and beyond the state allocation, and that would be a direct allocation from the federal government. They're doing 1 million nationwide, but that should be a couple of extra percent. It doesn't go through the state. It goes directly to the federally qualified community health centers. The federal government also runs a program directly to the pharmacies, which was announced last week. So you have the state allocation. You then have on top of that a federal program that goes directly to the pharmacies. This week they added a federal program that goes directly to FQHCs. And you had pre-existing a federal program that provided the vaccines to the nursing homes through pharmacies. So it gets complicated. You have the state-run program, then federal program to pharmacies, then federal program to pharmacies for nursing homes, and now a federal program to the community health centers. 4 levels for those of you who are tracking it. They also announced and discussed they are adamantly opposed to using second doses for first doses. Several health people have suggested that. The CDC and the FDA, Dr. Fauci publicly said over the weekend, they are opposed strongly to using second doses for first doses. That the second doses must be available for Pfizer and Moderna when they are supposed to be available. 3 weeks after the first dose for Pfizer, 4 weeks after the first dose for Moderna. And that is their position. And it was a strongly held position. There is discussion about reallocating unused vaccines. We have an unused allocation in the federal nursing home program, long-term health care facility program, where the federal government contracted with CVS, Walgreens, et cetera, to do the nursing homes. That program has been slower than anticipated, and we believe it was over-allocated. So we will be reallocating doses from that program into the general state allocation, and we're going to work to determine how much that is. But those are excess unused doses. and those are doses they don't need for that program. On the second dose program, if there are any unused vaccines, we can reallocate those. Unused on the second dose program means a person never showed up for their second dose. And this gets complicated too. If a person does not show up for their second dose, either 3 weeks on Pfizer or 4 weeks on Moderna, the state must keep it available for 42 days. In other words, on Pfizer, you're supposed to come back on day 21. On Moderna, you're supposed to come back on day 28. If someone doesn't come back on day 21 or day 28, you must hold the vaccine for them until day 42. After day 42, you could use that dose for someone else. 42 days is also close to the date of the expiration of the vaccine. So if it's not used, it would expire. But if that person comes back for the second dose, whenever they come back, you have to find a second dose for that person, even if it's after 42 days. So, frankly, from a numeric point of view, I don't think that's going to be consequential. But the reallocation from the long-term health care program could be consequential. That could be in the tens of thousands of doses. So we're working on that. Also, we talked about winter storms. We were right. The winter storms are continuing. New York City should see about 3 inches. We've deployed equipment all across the state. 6 inches of snow in the Tug Hill region, and 5-6 inches in Capital Region, higher terrains in the Hudson Valley. The state has deployed assets. Operator, let's take a couple of questions, please. Thank you.
As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Juliet Papa. From the 1010 Winds, your line is open.
Oh, hey, Governor. Good afternoon. How are you?
How are you, Juliet?
I'm good, thank you. So you had said recently that you thought rapid testing was the key to opening up New York State and to possibly use it for venues and events. So are you working with pharmaceutical companies to develop more testing like that, or is the state lab doing something like that?
We are working to establish the rapid testing sites. The tests exist, Juliet. You can buy the tests commercially because this has now been a year, right, when we started COVID testing. So the pharmaceutical companies have developed rapid testing. And you can buy the tests commercially. It's now logistically setting up a site, right? So where do you go for a rapid test? How do we get drugstores to offer rapid tests? How do we set up rapid tests at Penn Station and Grand Central Station? And then we're working on an app, APP, that can record your testing data. So if you open a theater or an arena, if you can show that you just got a test in 24 hours, 48 hours, 72 hours, and that you were negative, and use that as a key to the reopening. We experimented with this at the Buffalo Bills game, 7,000 people at a playoffs game. all of them tested before they came in, 7,000. We then extended that to catering halls, wedding ceremonies, up to 150 people. Everyone tested before they come in. And we're going to be expanding that to other venues. If people tested negative, then it's safe, and you're doing socially distancing, etc. And more importantly, then people should feel confident to come, right? You invite me to a wedding now and say there's going to be 150 people. I'm not going because I'm nervous. But if you tell me the 150 people have all been tested and were all negative in the past 12 hours, well, then I'll go and we'll dance, Juliet.
So where would you launch something like this?
Well, we reopened catering halls, etc. But the same theory is going to apply. If you can have 150 people in a catering hall, can you have 150 people in a movie theater? Can you have 150 people in an arena? Yes. It's the logistics and operations now of having enough rapid testing so it is available to you so that you can attend events, and then the economics of opening a venue with 150 people, right? It's not economic to open Madison Square Garden with the number of people who we would allow from a public health point of view to attend Madison Square Garden. But a smaller arena, it could be economic, and we're rapidly increasing the availability of the rapid tests.
Okay. So how about a baseball game?
Same thing. What's the difference between a Buffalo Bills stadium game and a baseball game at Citi Field? There is no difference.
Wow. Okay. Well, I'll dance with you.
I'll dance with you, Juliet. If I step on your toes, I'm just an Italian from Queens at the end of the day.
Thank you, Governor.
Thank you.
Thank you.
Next question, operator.
Your next question comes through the line of Chris Carlson from Circus Post Standard. You may ask your question.
Governor Cuomo, along the same lines, Syracuse University has said it's putting together a plan modeled after the Buffalo Bills. So for them to bring in 150 people, would they need their approval, or can sites just move ahead and kind of say 150 people is the limit?
We are going to put out standard guidance, but now if they want to open the stadium, an arena, they want to do 150 people, they'll do a testing protocol. We can work that. If you look at the Buffalo Bills model and you want to replicate that model, we can do that.
Do you have a time frame for the guidance kind of at this point?
The guidance is being put together now. Next week it'll be out. But again, if they look at the Buffalo Bills model and what was done, if the proposal is to replicate that, that worked. It worked.
Thank you.
Thank you.
Your next question comes from the line of Robert Rozachowski from AM New York Metro. You may ask your question.
Hello. Robert? Hello? Operator?
Mr. Robert, your line is open.
Operator, I think there's a problem. Let's take one more, operator.
All right. Your next question comes from the line of Josefa Velasquez from the city. Your line is open. You may ask your question.
Hey, Governor. Hope all is well.
Yes, how are you, Josefa?
hanging in there. So I just had a question about a nursing home in St. Albans, Queens. Several residents were given a experimental mix of hydroxychloroquine and azithromycin for COVID. Several families said that they didn't know that their loved one was receiving this medication. And I'm wondering whether who at the state level ordered that this combination of drugs be given to residents, why weren't families notified, and whether other nursing homes around the state doing something similar.
Joseph, are they saying that it was, I doubt it was a state-ordered medication in a nursing home. The state doesn't do that. But we have and we were very skeptical of hydroxychloroquine all along, as you remember very well. And my position was it was bogus from the beginning, and it turned out to be bogus. But I don't believe that's a fact that the state asked to do that. Dr. Zucker would know. Dr. Zucker?
Sure, thank you. So you can't discuss the specifics of the nursing home in question, but in the larger context, remember early in the pandemic, we had little information about COVID, and the initial indications showed that the hydroxychloroquine plus the azithromycin might be a life-saving treatment, although we learned that was not the case. So there was an emergency use authorization, and we used that treatment in New York when it was obviously medically indicated. But we said from the beginning that we would follow the science, and that's exactly what we did. And when we realized that the data did not pan out, we stopped using it. And that was a doctor-patient discussion at whether it's a nursing home or any other facility regarding this issue.
Yeah, but let's be clear here, Doctor. It's not my field, and I don't have the specifics. The state doesn't order medication for a patient. The patient's doctor orders a medication, right. And that's between the patient and the doctor. The state doesn't tell a doctor what to do.
Right. That was the doctor.
And then the emergency authorization is from the federal government, right?
That's correct. That was from the federal government. Yes.
Yeah. So when the federal government, if you remember, authorized hydroxychloroquine on an emergency use basis. And then there was a run at the pharmacies on it. So it's a federal authorization, and it's dispensed by a doctor.
Gotcha. And I just had a quick question about restaurant workers who are trying to get vaccinated. There is some confusion as to where they can go if their locality, in this case New York City, opts into the expanded eligibility. So aside from local or city-run vaccination sites, where else can restaurant workers, cab drivers go to get a COVID vaccine?
I'll give it to Melissa. Are you asking for just restaurant workers and cab drivers, or are you saying all 1B workers?
Just for those two specific groups.
Okay. Melissa?
So what we had decided, and the governor announced, I believe it was last week, when we got the additional allocation from the federal government, was that it was up to a locality to decide. So the localities are doing the 1B essential workers, and it's up to the locality to decide whether or not to opt in. I know that some counties in Western New York decided against it, and they were going to continue on the original prioritization. I know, obviously, New York City decided to do it. I did see your story, Josefa, on the issues specifically at Yankee Stadium, and I will dig into that. But the original decision had been that if the locality decided that they did want to put those workers in, that we would remain to the locality because they are the ones that are strictly doing their workers. So to prevent people from venue shopping, going in and out of other counties. But I understand the issue, obviously, with the mass vaccination site in the Bronx, since that is a city-state partnership. So if it's okay, I just want to look into that specifically and circle back to you.
Great, thank you.
Okay, thank you, Josefa. All right, so just to recap, the big news to me is continued decline of the holiday surge. from the White House, 5% additional supply to the state. They announced a new community health center direct allocation from the federal government, which will be in addition to the 5%. We will reallocate some of the unused vaccine from the nursing home program. They will not allow second doses as first doses, but if somebody doesn't come back from a second dose for 42 days, we could use that dose, but that's going to be numerically not significant. And 10% of New Yorkers have received a first dose. That is a big deal. And this vaccine is the weapon that will win the war. I know everybody's tired. Joseph, I said, how you doing? Hanging in there. We're all just hanging in there. It's been a long year, my friends. But we know the vaccine is successful, and it's now a question of production and supply. So there's reason to be optimistic and hopeful. The numbers are coming down. The vaccines are going up. Spring is coming. Spring is coming. Glass is half full. Thank you.